Well, good afternoon, everyone. Welcome to University Medical Center. I'm Mason Van Houweling, the Chief Executive Officer, and today is an historic and exciting day for UMC and our community and our first-line responders. So as of this morning, was notified that the COVID vaccination Pfizer was arrived to Las Vegas, and UMC was prepared and ready to receive the first initial shipment of the vaccine. So after 10 long months and very hard work by all of our frontline workers, all our care and compassion and understanding in the state of Nevada, the solution is inside and being vaccinated and rolled out to all of our employees. We've already vaccinated about 200 individuals today, a mix of individuals that are working inside UMC, inside our COVID units, treating patients, from doctors, nurses, respiratory technicians, EVS, pharmacy, and many others. So we're very excited. Again, we really had tears in our eyes as the vaccine was arrived here at UMC today, and we immediately started rolling it out to our employees who were very excited and eager to receive the vaccine. So again, the solution's here. It's been a long road, and we're very excited to be able to be the first hospital to roll it out in the entire state. So we prepared many days and weeks for this. And again, we will continue to vaccinate throughout the rest of the week and fully vaccinate all of our employees in the next 7 days. We received around 1,850 vials of the Pfizer COVID vaccine. It takes about 30 minutes to dethaw the vaccine, but we're doing a systematic approach to be able to roll that out to make sure we're being very efficient and effective and not having any waste at all. But again, we've done a few hundred employees inside, and we will continue to vaccine and immunize our employees throughout the rest of the week. So with that, I just want to say I appreciate the partnership with the state, the health district, our federal delegation, and all the researchers and scientists, but most importantly, those individuals that volunteered to be in the trial for the vaccine. It really is a life changer, and I see hope on the horizon and things moving very quickly for our community. So with that, I'm open to any questions you may have.
Can you talk about, you said 1,850 vials. Is that just for the first dose, and how many will you do a day? And are those employees who get it, do they continue working throughout the day as well?
Correct. So we have an entire process here at UMC. It's very thorough, well thought out, and follows all the CDC and health district guidelines. So in fact, I will, let me get here in my pocket here. This is actually the first vial that was actually given today. This is empty. It's already been utilized, but in this vial, we're able to get 5 doses of the vaccine out to our employees. So it's 1.5 milliliters. So we break that down in 0.3 micrograms, and we're able to dispense this very quickly within about 15 minutes to 5 employees. So again, this is the first vial that's been administered in the state of Nevada.
Break it down. So each vial is 1,850. You multiply that by 5, and that's how many people will get it?
Correct. So we'll break down those vials and those doses. They come in 975 vials in a frozen block. So what we do is systematically break that block up. We dethaw them. Takes about 30 minutes. But if we don't dethaw them, they can stay in the freezer for up to 6 months. But we anticipate thawing all the vaccines that we have here and rolling that out in the next 7 to 8 days.
And I'm sorry, how many different employees will get vaccinated a day, and how many employees do you have total who will be receiving it?
Yeah, we have about 4,000 employees here at UMC alone, but we also vaccinate our partners at UNLV Medicine and our community doctors. So you can add another about 800 on that number. So we'll do close to 5,000 over the next 7 to 8 days. Again, it's frontline workers initially, those that are actually treating patients, actively treating patients. We have about 129 patients in UMC currently that we're treating actively for COVID. And so a lot of that staff was here early this morning. And then 21 days later, they'll get the second vaccination, the booster. And then we're tracking that very closely. So, but again, very thorough process that we have inside. We go through a lot of screening questions, making sure people are immune compromised or blood thinners or pregnant or breastfeeding, those type of things. So, and then we'll actually administer the vaccine. We have them wait for 15 minutes to make sure that there's no side effects or reactions. We have not had any yet today. I'm very encouraged, and the staff are back at the bedside. So it's going very smoothly today, and I just want to say thank you to the UMC team to making it so smooth and really effortless. They are doing a great job, and lots of excitement, and like I said, lots of tears this morning because the solution is here. Oh yeah, okay, I'll come to you, Mary. Okay.
Once you thaw the vial, can you refreeze it, or do you
No.
have to use it right away?
So we have, once we thaw it, we have 5 days. 5 days to administer the vaccine. So time is critical and of the essence. So we're moving very quickly and trying not to push up against that 5 days, but they're defawing fast as we can, and the demand is there. So we have no problems to meeting that 5-day time frame.
And is it mandatory for your staff, or is it voluntary?
It is voluntary, highly encouraged. We have a lot of interest, so but we're tracking every employee that's had the vaccine initial and then the second booster, and following them to make sure that they come back and make sure that they're fully protected. And but again, not mandatory in the state or the country yet, but we're probably going to see greater than 90% acceptance rate. Mary.
Hi, Mason.
Yeah.
You're vaccinating CVS and Walgreens folks here. Is this a vaccination hub?
So no, so what we have, Mary, today is we got a call very early on. We're really expecting to roll this out Wednesday, but we got a call from the health district and said, it's here. I said, we're ready, and let's get it rolling. So this all happened within a matter of hours. It was transported from the health district right around 11:10 today, 11:10 a.m. We started vaccinating our first employer around 11:45. As you can see, that de-thawing process, and then administering to our first frontline workers. So not anything related to Walgreens or CVS. This is solely healthcare workers at this point, tier 1. Yep.
Is there any plan to get the vaccine to, and how does this work with patients who are maybe at the hospital with COVID or on the hospital beds? Are they even able to get the vaccine while they're in the hospital? And if they are, when would they be able to get the vaccine?
Yeah, we're looking at all those patients that may be compromised, vulnerable. Within that tier 1, as you know, nursing home patients are the most vulnerable. So we'll be working very closely with the nursing home community and the health district to be able to roll that out to make sure that we're protecting the healthcare workers in nursing homes, but also in patients in the nursing homes. And we'll also be looking at our patients that are in UMC as well. We need to get through the healthcare workers first. Obviously, we're in protective equipment, doing all the therapeutics and treatments, so we're doing really well at the hospital. And again, just very grateful for the time the state gave us to be able to prepare for this historic day. It's here, and we're looking good. We're very excited.
And this is just the first dose you received so far, correct? So when do you receive the second dose, and how many of those minus 80 freezers do you have available?
So yeah, UMC, we have to keep this in deep storage, so negative 71, 73 degrees. We're able to receive a lot of the vaccine, so it'll be coming directly to us after this first initial wave from the health district. And again, they'll be coming daily. So I don't anticipate any run on the vaccine or being short at all. It's moving very quickly, and again, very appreciative to all those that have been able to get it here in our community.
Have there been any lessons learned in the first day of vaccines leading to any changes in the near future in the process?
You know, I like to say we've learned a ton, and we're fixing a lot of things in the hospital and in the vaccine process, but you know, we've been preparing for weeks. We have a great team here at UMC, and great partnership with the health district. So, you know, as we speak, they're shipping more to us. So we're it's in the process, but you know, we're working out some efficiency, trying to get quicker and faster on it. But everybody was excited, and again, a very pleasant surprise this morning to be able to start rolling out the vaccination to our employees before noon.
Is it your understanding they were the first people in Nevada to get the vaccine?
Yes. Yep. The first vaccine was given here to a UMC nurse that's treated many COVID patients in our ICU. It was a great story, many tears in our eyes, and she went right back to work. So it's not over. We still have a long road, and just you know, really stress to our community, please continue to do the things that we've been asking you to do. There is light at the end of the tunnel. Very appreciative that the governor kept us in a pause and that we didn't roll back any more restrictions. He was here this morning, saw the process, was very pleased, and yeah, that's that the first person in Nevada was vaccinated and was an employee, UMC, a nurse in the ICU.
Did the governor also receive a vaccine?
No, he is waiting just like I am, and we're going to let everybody get going first. We will be the last, and he was just very appreciative of the hard work of the employees here at UMC. As you know, this has been his hospital for many years. He knows us well, and just wanted to come out and thank the staff and those that were given the vaccine in the health district.
Where are you with hospitalizations right now, both with and without COVID, and what are you guys doing? Will this help towards that?
You know, I think it's gonna take a little while to see the effects. You know, I think the key is protecting our frontline healthcare workers, so they have a little bit more peace of mind that the vaccine is taking effect, and we're going to be tracking that very closely with side effects and how they're doing. The hospital is about 88% full. About 32% of our patients are COVID. But at UMC, we do a lot of testing on every patient that comes through, so we're unique. So about a third of those patients we're detecting that are asymptomatic. They're here for other reasons. So we're able to very quickly provide precautions, do the PPE, treatments and therapeutics. But we're about 88% of our capacity right now, but we're really doing well. Again, I'm appreciative of the governor holding the line where we're at. We think it's effective. It definitely could be a lot worse if we weren't in the situation, but you know, again, hope is on the way, and the vaccine will take a few weeks, and especially as we get it out to the general community.
And staffing levels are good as well right now?
Yeah, staffing's tight. You know, we continue to work hard. Lots of extra shifts and lots of overtime being worked, but the morale is very high. And again, this is just a boost in the arm for the morale as well.
Mason, are you
Yeah.
finding there are some staffers who are saying they don't want to get the shot?
So the question is, if are there staffers that are a little hesitant to get the shot? I think, you know, seeing the folks come through the line today and seeing some of our leaders and nurse managers and folks that are out there on the front lines, I think we're going to have a very good acceptance rate, Mary. But we will have those that kind of wait and see how it goes, just like with the flu vaccine every year. You know, we still have portions of our population and our community that just will, you know, forego the flu vaccine. So I suspect that will be the same here in Nevada, but I think many are very eager to get this, and I know my phone is constantly blowing up on when it's going to be rolled out to the community. And I think rolling out to the general public will probably be more late January timeframe, early February. Hopefully sooner, but no later than March.